You are sitting at the dinner table right now. Maybe you finished your meal a few minutes ago. Maybe you felt a little bloated but told yourself it was just the food. Maybe last week you noticed something in the bathroom that made you pause for a second, but then you decided not to think about it. Maybe you have been more tired than usual for the past few months, but you told yourself that is just what getting older feels like. I need you to stop and really listen to what I am about to tell you, because those three things you just dismissed, the bloating, the bathroom change, the fatigue, may not be aging. They may be your body trying to tell you something that your life depends on hearing. The American Cancer Society publishes one number that I think about every single day. When colon cancer is caught in stage 1 before it is spread anywhere, the 5-year survival rate is 91%. When it is caught in stage 4 after it has already spread to other organs, that number collapses to 13%, 91% versus 13%. That is not a small difference. That is the difference between watching your grandchildren grow up and not being there at all. And what separates those two outcomes is almost never luck, almost never genetics. It is almost always one thing, whether the early signs were recognized in time or dismissed as something else. Every single day, in homes across America, adults over 60 are experiencing the early signs of colon cancer and calling them something else. Aging, stress, bad food, a busy week. And by the time they find out what those signs actually were, the window has already closed. By the time this video ends, you are going to know exactly what the 7 earliest warning signs of colon cancer look like. Not in medical textbooks, but in real daily life. In the moments you would actually experience them. You are going to understand why each one gets missed, and what to do the moment you recognize any of them. And stay with me, because sign number 6 is the one I have seen dismissed more times than any other in my 32 years of practice. And it is the one that, when caught early, gives you the best possible chance of the outcome you want. My name is Dr. William Lewis. I have spent 32 years in internal medicine and gastroenterology, and I have had more conversations about colon cancer than I can count. Conversations in examination rooms, in hospital corridors, and at bedsides where the news was still good, and bedsides where it was not. I want to tell you about a patient I will call Robert. 71 years old, retired electrician from outside of Cleveland, the kind of man who had never missed an appointment in his life. Blood pressure checked every 6 months, cholesterol managed, medications taken on schedule. He came to me one afternoon not because he was worried, but because his wife had insisted. He had been losing weight without trying, about 8 pounds over 4 months. He felt tired in a way he described as deep, like the fatigue was coming from somewhere inside rather than from his day. And he had noticed more than once that his stools were narrower than they used to be. Robert had attributed every one of those things to different causes. The weight loss he thought was his appetite changing with age. The fatigue he blamed on poor sleep, the narrow stools he had never mentioned to anyone before that afternoon. When I heard those three things together, I knew immediately what we needed to rule out. Robert had stage 2 colon cancer. We caught it before it had reached the lymph nodes. He had surgery, he recovered, and today, 4 years later, he sends me a card every Christmas. He is still here because his wife made him come in, and because he finally said out loud the 3 things he had been dismissing for 4 months. Before I walk you through the 7 signs, I want you to understand something about how colon cancer behaves, because once you understand this, everything else makes sense. Think of your colon like a long, quiet hallway in your house, a hallway you pass through every day without really looking at the walls. Colon cancer almost always starts as a small growth called a polyp, a tiny bump on the wall of that hallway. For months, sometimes years, that polyp sits there silently. It causes no pain. It announces itself with nothing dramatic. But as it grows, it starts to change the hallway. It narrows the passage. It bleeds a little when things brush against it. It disrupts the traffic moving through. And all of those disruptions, the narrowing, the bleeding, the altered traffic, are exactly what the 7 signs are. Your body is not being dramatic. It is reporting as accurately as it can that something has changed in the hallway. The tragedy is that most people hear those reports and translate them into something less frightening because the truth feels too big to hold. Do not do that. Hear the report for what it is. Before I continue, I need to say something clearly. Everything I am sharing today is educational information based on published clinical research and guidelines from the American Cancer Society and the National Cancer Institute. It is not a replacement for your personal medical care. If any of the signs I described today apply to you, do not finish this video and wait. Call your doctor's office today. Not next week, not after the holidays, today. You are your own best advocate, and the most powerful thing you can do after watching this video is pick up the phone. Sign number 1 is a change in bowel habits that lasts more than 2 weeks. This is the sign most people know about and most people still dismiss. Going more often than usual, going less often, alternating between the two with no explanation, stools that are consistently looser or harder than your normal. The key word here is persistent. A single bad day after a heavy meal is nothing. A pattern that continues for 2 weeks or more, without a clear dietary explanation, is a conversation your doctor needs to be part of. In Robert's case, the change had been present for 3 months before he mentioned it. 3 months. Most people do the same thing. Sign number 2 is blood in the stool or on the toilet paper. I want to be very direct about this one because it is where I see the most dangerous delays. People see blood and they immediately think hemorrhoids, and sometimes it is hemorrhoids. But here is what matters. You cannot tell the difference between hemorrhoid bleeding and colon cancer bleeding by looking. They can appear identical. The only way to know is to be evaluated. If you see blood, even once, even a small amount, even if you are certain it is hemorrhoids, tell your doctor. That one conversation could save your life. Do not wait for it to happen again. Do not wait to see if it goes away. Tell someone. Sign number 3 is unexplained weight loss. Losing 5 or more pounds without trying, without changing your diet or activity level, without any other explanation. This is a signal your body is sending that something is consuming resources it should not be consuming. Tumors are metabolically active. They demand energy. They alter appetite. They change how your body processes what you eat. Unexplained weight loss in an adult over 60 is never something to monitor and wait on. It is something to investigate. And sign number 4 is even more alarming. So stay with me. Sign number 4 is persistent fatigue that does not improve with rest. Not tiredness at the end of a long day. Not the need for an afternoon nap after a busy week, but a deep, bone-level exhaustion that is present in the morning, present at midday, present regardless of how much you sleep. This happens because slow, low-level bleeding from a tumor in the colon causes iron levels to drop gradually over time, a condition called iron-deficiency anemia. Your red blood cells, responsible for carrying oxygen to every organ in your body, become depleted. And the result is a fatigue that no amount of rest resolves because it is not coming from your schedule. It is coming from your blood. Most seniors who experience this attribute it entirely to age. Most of them are wrong. Sign number 5 is abdominal discomfort that keeps returning. Cramping, gas, a feeling of fullness that does not resolve, or a dull pressure somewhere in the lower or central abdomen that comes and goes without a clear cause. Not every stomachache is cancer. I want to be absolutely clear about that. But a pattern of recurring abdominal discomfort in an adult over 60, lasting more than a few weeks, without a clear dietary or gastrointestinal explanation, is worth a proper evaluation. The discomfort from a growing polyp or tumor is often mild enough to dismiss. That is precisely why it is on this list. Sign number 6 is the feeling that your bowel never fully empties. This is the sign I promised you, the one I have watched be dismissed more times than any other in 32 years of practice. Patients describe it in different ways. A sense of incomplete evacuation after a bowel movement. The feeling that you need to go again immediately after you just went. a persistent pressure or heaviness in the lower abdomen that does not fully resolve. This sensation, called tenesmus in clinical terms, is caused by a tumor in the lower part of the colon creating a false signal that more stool is present. It feels like a minor inconvenience. It feels like something you just learn to live with. Do not learn to live with it. Report it. Because when this sign is caught early, it is pointing to a tumor in one of the most accessible, most treatable locations in the entire colon. I have seen this sign lead to early stage diagnoses more times than I can count. And I have also watched patients wait 18 months before mentioning it because they were embarrassed or because they thought it was just how things were now. It is not just how things are. It is a signal. Hear it. This is the sign that separates survival outcomes because when caught here, in the lower colon, accessible to screening procedures, intervention changes everything. Stay with me because the seventh and final sign is one that most people never connect to colon cancer at all. Sign number 7 is unexplained iron-deficiency anemia discovered in a blood test. This one is different from the others because you do not feel it as a symptom. You find out about it at a routine blood panel. Your doctor tells you your iron is low, your hemoglobin is low, and asks about your diet. And if there is no obvious dietary reason, if you eat enough iron-rich foods, if you are not on medications known to cause anemia, then the source of that iron loss needs to be identified. In adults over 60, with no clear dietary explanation for iron deficiency anemia, the colon is one of the first places to look. Slow, chronic bleeding from a tumor, invisible to the eye, can produce exactly this picture in a blood test. If you have been told your iron is low and nobody has asked about a colonoscopy, ask about it yourself. If this is the first time someone has explained these signs to you this clearly, not buried in a pamphlet, not rushed through in a 12-minute appointment, please hit that subscribe button right now. This channel covers nothing but the health information that adults over 60 need and deserve to have explained in plain language. Every video is built on real research. Every video is designed to give you what your doctor does not have time to say. Subscribe now. I want to come back to Robert for a moment. When I told him the diagnosis, his first response was not fear. It was anger. Briefly, quietly, and then he said, "I knew something was wrong. I just kept telling myself I was being dramatic." He was not being dramatic. His body was reporting accurately for 4 months. The hallway was sending signals. He just did not know what they meant yet. That is what this video is. That is what this channel is. The translation your body has been waiting for you to have, so that the next time a signal comes, you do not dismiss it. You act on it. You call. You go in. You give yourself the chance that Robert gave himself, the chance to still be here, still sending Christmas cards, still watching his grandchildren grow up. That chance is not luck. It is information, used in time. Here is what I want you to do today. Not next month. Today. Step 1. Think honestly about the past 4 to 6 weeks. Have you experienced any change in your bowel habits that has lasted more than 2 weeks? Have you seen any blood? Have you felt persistently tired without explanation? Write down anything that applies. Step 2. If anything on that list is true, call your doctor's office today and use these exact words. I have some symptoms I want to discuss that may be related to my colon. Those words will get you an appointment faster than a general request. Step 3. If you are over 45 and have not had a colonoscopy in the last 10 years, ask your doctor about scheduling one at your next visit. A colonoscopy is the gold standard for colon cancer detection. It is covered by Medicare. It is not painful, and it is the single most powerful tool available for catching this disease at the stage where treatment works best. Step 4. Share this video with one person over 60 in your life today. A spouse, a sibling, a friend. You may not know whose life that share protects. Step 5. Check your last blood panel. If iron or hemoglobin were flagged as low and nobody followed up with a colon evaluation, bring it up at your next appointment. Ask specifically. Before you go, I want to ask you two things. First, write your age in the comments right now, just the number. The age of this community shapes every video I make, and I read every single comment personally. Second, has any of the 7 signs I described today surprised you? Was there one you had been experiencing without realizing what it could mean? Tell me in the comments. Your answer may be exactly what someone else who is reading needs to see. And before you close this video, there is another video on this channel that covers something just as important for your protection. Information that most adults over 60 have never been given, explained the way it deserves to be explained. Go watch it now. What you learn there may be the piece that completes the picture. Take care of yourself. I am Dr. William Lewis, and I will see you in the next one.